Alrighty, so welcome everyone to our October Pláticas. I had to think for a moment, what month are we in? It is October. My name is Ann Endress. I am the Title V HSI Director at Cabrillo College. And I'm also going to share my screen really quickly. But actually, before I share my screen, I just want to welcome everyone. I know that evenings are times when people are really busy. So I love seeing all the people that are here this evening and whoever watches our Plática into the future. If people can take a moment and introduce yourselves in the chat, just say your name, your role. Are you a student? Are you a faculty member, a community member? And then maybe also one thing that you're interested in learning about tonight. And while you all are doing that, I'm going to share my screen and just kind of give us an overview of what we're doing tonight. So we hold monthly Pláticas every month, and we showcase a transfer pathway between Cabrillo and CSUMB, and we invite a career speaker to also talk about their academic and career journey. So this month, we are looking at health and human services. At Cabrillo, those are two different programs. We have a human services program and we have a health science program. And at CSUMB, there's one program called Collaborative Health and Human Services. So our students kind of funnel up from these two different programs at Cabrillo into CHHS at CSUMB. So tonight, I'm going to give you a little welcome, introduction, talk a little bit about a new program that we have at Cabrillo called Cabrillo 2+2 CSUMB. And then give little overviews of our health science program, our human services program, and then the CSUMB program. And so after we kind of get this little overview of our different academic programs, we have the gift of two students who are tonight, who are going to be our student panel, and they're going to just share their own perspectives and experiences with us, which is a highlight for sure of these events. And then towards the end, we're actually going to have our career speaker, Lilia Chagoya, the Regional Operations Director for Santa Cruz and Monterey County's Central California Alliance for Health. And that will be another like storytelling time towards the end, hearing about academic and career journeys. And then at the end, we'll have like just open Q&A and conversation. And also throughout, if you have questions, you can pop questions in the chat and we'll just try to monitor that and make sure that we answer those questions. So as I mentioned earlier, we have a program at Cabrillo that's called Cabrillo 2+2 CSUMB. This just started last year, so it's still pretty new. And the goal of our program is to really support our students to be on a strong transfer pathway to CSUMB by spending 2 years at Cabrillo and then 2 years at CSUMB. You get your bachelor's degree in 4 years. And really wanting to let our students know, especially high school students, that if you choose Cabrillo, you can be on a strong transfer pathway to many different institutions, but CSUMB is one of our really strong partners, and that we're here to help you achieve that goal. And also the first 2 years at Cabrillo are free. They're tuition free. So it can be a very smart choice for students that are wondering, how am I going to afford, a university? It seems really expensive. Well, you can spend 2 years for free at Cabrillo. We'll get you over to CSUMB to finish in 4 or 5, but there's a pathway to do it. And then just program elements of the 2+2 program, we're really focused heavily on community and having our students feel really connected and know that they know exactly who to go to get support. They get one-on-one advising, transfer guidance, and a lot of connection to CSUMB. Our goal is to really have our students feel like they're, the current Seahawks, but they're future Otters, and to have a lot of connection to CSUMB happening really from day one. And then connection to resources, of course. And that is a picture of our new mural at Cabrillo that we're really excited and proud about. So with that, I'm actually going to stop sharing so that we can see each other easier. And I want to go ahead and have Elisa Steiner talk to us a little bit about the health science program at Cabrillo.
Thank you, Anne. Hello, everyone. Good evening. It's nice to be here with you all. So I teach in the Health Science Community Health Department, and I'm current chair of that department. And I'm just going to share a little bit about the programs we have and our classes. We currently have both a transferable health science AA degree and also a community health worker certificate. And we're also very excited to be working on a public health degree, just starting that now as well. But for what we have existing right now, our AA degree prepares students for an academic and career path to promote individual and community health and prevent disease and injury. Health science graduates work in health education, nutrition, counseling, clinic and hospital administration, and public health, among other areas. Our community health worker program certificate trains students after just 1 year of coursework to immediately give back and get health and wellness jobs directly in their local community. Our classes are fun, they're fascinating. I'll tell you a little bit about what type of coursework we have. But in all our courses, we teach very interactively, lots of group projects, very up-to-date readings based on the latest research. We have guest speakers, small discussions, low pressure presentations, and even sometimes creative art group projects, which are a lot of fun. The courses we teach are personal health, stress management, community health worker work and community health worker skills, human sexuality, health and fitness, and environmental health. So very diverse classes, but students really find that they can enjoy relating that coursework to their own lives. So in our courses, you'll learn how to improve your own wellness, the health of your community, and also how to even improve the health of our planet. So if this life-disrupting pandemic we're in the middle of has taught us anything, it's that our health is very interconnected, directly in our communities and also globally. So more than ever, we need well-trained health educators and public health professionals, community health workers for a healthy future. And we hope you'll study with us in this exciting, fascinating, and vitally important field of health science. Thank you.
Thanks, Elisa. That was really, I think, so true that if people weren't really interested in health or health science before 2020, right? It's so important and just increasingly so. So I hope more of our students get interested in the program and take classes. Yeah. Gail West, let's have you go ahead and talk a little bit about our human services program.
Thank you so much. I'm so excited to be here. I'm seeing people that I've met recently and some students that I know, and definitely colleagues. And I really like talking about the human services program. I'm a little biased. I've been at Cabrillo and teaching in the program since 2003. So I'm kind of an old timer, but it's one way that I stay really cutting edge and energized, especially with our students and their amazing input and learning. So the Human Services Program is part of the Career and Technical Course Program at Cabrillo. And usually people that are thinking about careers in social work, counseling, alcohol and drug prevention, mental health, would be interested in exploring our program and finding out more. So some of our students are brand new, some out of high school, and some of them are students who are interested in maybe finding a new career and re-entering skills or upgrade a job with academic credentials. So we have a very diverse student body, which makes us really, really enriching and fun and energizing. There's never a dull moment in a human service course or class. So there's a couple things that you can do with the Human Services Program. One is to get your AS degree in human services. There's also currently 2 certificate programs, and one is a human service generalist practice certificate. The other one is the alcohol and drug specialist certificate, which many of our students are pursuing. In addition, our program is also recognized by California State certified alcohol counselors, and I'm probably going to say that all wrong, and Dulce may know, but it's the body of California State that says, yes, you can be credentialed, and they recognize Cabrillo coursework and our practicum experience as part of that, which is really important when you're looking to pursue that credentialing. So a couple of things our program does that I think is really important is to blend classroom learning with work experience. So students are required to take at least 2 units of something that we call a practicum. And that's actually working in the field in a community-based or a nonprofit or a county agency that works with human service kinds of issues and populations. So students have been placed at programs like Encompass, Live Oak Family Resource Center, CASA, Head Start programs. Even on Cabrillo's campus, students can often find placements. Some of those placements are paid experiences. Many of them are volunteer, so kind of depends on where you are. But one of the highlights of the practicums is that students network so importantly in these practicums, and they often find work. So that's something that I think is so valuable about our program. The other thing that I think is valuable is, as I talked about before, the diverse experiences and backgrounds and perspectives that students bring create really lively classes, which are fun. And they also help broaden our understanding of each other in the world, and gives us so much more depth in terms of our where we want to go from here in terms of career pathways. I mean, students often come in with sort of a set idea, oh, I want to be this or I want to be that, and then learn primarily from their classmates, oh, there's a lot of opportunities, and some things I haven't thought about are important to pursue. So that's another piece. And then the other piece, and I may be a little biased, but that's okay. Human service students rock. They bring passion, they bring commitment, they bring compassion to themselves, to their fellow peer students. Everybody networks all the time and stays in touch. And then they bring that out into the community. So a lot of our leaders now in different community agencies were former Cabrillo HServe students. So it feels like a community, a real family. And I think that that's something I know I love about the program. And I think it really inspires and keeps us motivated. So that's mine for now. Thank you.
Thank you, Gail. That was wonderful. We have so many great programs at Cabrillo, and you're right, our students really are the truest shining stars and gifts that are so inspiring, keep us going. So both of these, 2 different programs, a lot of our students at Cabrillo are interested in transferring to CSUMB, and students from both of those programs end up typically transferring, if they go to CSUMB, into the Collaborative Health and Human Services program. So I'm going to hand us over to Dr. Vanessa Lopez Littleton, so she can tell us just, again, like a brief overview of the CSUMB program.
Yeah, thank you so much for that, Anne. I'm Dr. Vanessa Lopez Littleton. I am the chair of the Department of Health, Human Services, and Public Policy. I'm super excited to be here tonight and to share with you just a brief overview about our program. So it's called Collaborative Health and Human Services. So we kind of merge those two together. It is our degree program that's a part of the Department of Health, Human Services, and Public Policy. And I thought I'd start by sharing with you like our mission statement, but I think what I'll do is I'll drop it in the chat so, so you can have it. I don't want to just kind of read it out. I want to make sure that I honor you guys with your time. But what the Collaborative Health and Human Services program is all about, it's an interdisciplinary degree program that includes public administration and nonprofit management, public health, and social work. And so on a lot of other campuses, those are individual programs and degrees, but we value that interprofessional learning, and we found that there's just tremendous value by having students work and gain experience across disciplines. So not having a siloed approach, but really at the baccalaureate level or in that bachelor's degree, allowing students to have the experience and have the exposure of 3 distinct disciplines is something that really sets us apart from a lot of other degree programs. And so the CHHS degree program really prepares our students to serve and also to lead in health and human services. And we find that our students land in a variety of career fields, not just public health, not just public administration, not just social work, but some programs and some projects that intersect and that cross those disciplines and allow those students to use those skills as they lead and manage organizations. We have a model that also allows our students to do experiential learning. So all of our students do a 3-semester experiential learning program where they're immersed in an innovative learning experience that truly encourages collaboration. It provides real-world experiences and enhances their leadership skills. So all of our students partner with local nonprofit and public organizations to develop a community-based project that really focuses on addressing a complex social problem. I think this also sets us apart from most other undergraduate programs. As a part of this 1-semester capstone, our students get credit for completing a community-based project while they're in their internship program. And so we think that this is one of kind of like our shining stars of our program because of the impact that it has. Our students are actually getting real world work experience. Say that 3 times real fast, right? So they get that real world work experience, and it's something that sets them up for success as they leave their college experience. And so I'll share with you just briefly, we have 7 major learning outcomes, and these are the things that all of our students from CHHS walk out of the door having these skills. The first one is collaboration and ethical leadership. Then there's equity and social justice. And next, integrated and disciplinary knowledge of health and human services. And that's so important because we are an interdisciplinary degree program. And we want to make sure that we have taken the time in our curriculum to show students how these programs are interconnected and how this kind of like the power of being connected, not just to one discipline, but across disciplines, how important that is. And then we have policy, politics, and public action, because it's not just having the disciplinary knowledge that makes an impact in our community, but also how do you apply this in the public sector? How do you get local and state governments to support your ideas and your concepts? And so that's why we value policy, politics, and public action. Professional communication, because that is so key in the public sector, to be able to articulate yourself, express your ideas in a clear, coherent manner. All of those things become super important. And then the last 2 are professional development and application, and research methods and information literacy, because we do value science and we do value research in our program. So that's just like a brief overview of our program, some of the different components that we have that's a part of it. But I'm super excited that our students are here and they're going to be able to respond to your questions and get you a little bit more engaged in what CSUMB has to offer. So thank you.
Thank you, Vanessa. That was, I think one of the things, every time I do these pláticas and I hear about these programs, I think I want to go back to college. These all I just love everything that you just talked about in terms of being interdisciplinary and having those 7 different learning outcomes. It sounds like a really, really great program. And one thing that stood out to me is how both at Cabrillo and CSUMB, it's similar that we're having our students get that real world work experience, whether it's through an internship or a practicum, and really connected to the community. So some natural synergy and similarity between our programs. Yeah. Great. So now we get to hear from our student panelists. And also I want to welcome Sharon Anderson. I see you were able to join us tonight. It's good to see you. Good. So I'm gonna go ahead and ask some of our student panelists some questions. We have both Dulce Lizarga Chagoya and Brianna Amezcua tonight with us, and I'm so grateful and thankful for your time. I'm going to start off with a question from Dulce. Dulce, if you can introduce yourself and then just talk about some of the highlights of your experience both at Cabrillo and CSUMB in these different programs.
Okay. Hello, everyone. My name is Dulce Lizarraga Chagoya. I'm currently a senior at CSUMB. I transferred from Cabrillo College with an associate degree on human services and health science as well. The highlights is the sense of community that I actually enjoy in both places, which under Gail and Patrick's programs, it was just amazing how my passion kind of like grow, to continue forward with my education. And they were very supportive when telling me, or not telling me, but helping me to choose for a higher career. So they helped me to make the decision to transfer to CSUMB and continue with the path of collaborative health and human services, which it's been an amazing experience for me being in that department.
Thank you, Dulce. And then Brianna, same question, just introduce yourself and then some of the highlights both for you.
Okay, my name is Brianna. I am a transfer student from Cabrillo, but I actually transferred with my liberal arts because I actually didn't know where I wanted to go exactly, and that's okay. You can transfer. The good thing about the CHHS program is that like Vanessa was saying, you do a little bit of everything. You do a little bit of public health, a little bit of public administration, and a little bit of social work. So I am a senior. This is my last semester, and I actually have an interdisciplinary in social work and public administration. I think the biggest highlight for me is my internship. When you hear that, a lot of students are like, especially your first semester there, it's kind of scary and you don't know. And I ended up, I'm doing my internship at United Way for Santa Cruz County. And I am the assistant to the CEO there. And I actually, from being there, I actually got a job opportunity to be an accountant there. So that's was the biggest highlight. Now I'm already set with my job and I'm super happy about that.
Yeah. Congratulations,
Thank
Brianna.
you.
And I think they are very lucky they're like, ooh, we scored. Okay, so second question, we'll come back to you, Dulce, first. So what do you wish you had known when you were a student at Cabrillo or when you first started at CSUMB?
For that, I would have said prepare myself a little bit more, like what I was getting myself into, because it was very challenging at first. Completely different experience. I mean, I felt like I was lead by my hand on Cabrillo, and then going into no, let me explain it to you. You might have to do it this way so you can, learn. And it was the transition, that I had a difficulty with at first. But then other than that, I mean, it's like I said, again, it's just been great. I mean, it's the support in both departments has been amazing. So I'm part of the TRIO program at CSUMB, which is another outlet for me to anything that it comes my way and I'm not familiar with, then I can, obtain their support as well. So, yeah.
All right, Brianna, over to you.
I can definitely agree with Dulce. That's what I was taking notes before, and I was like, that's exactly what I was gonna say. I feel like at Cabrillo, you guys baby us. We're your babies, and it's so much smaller. You're going to CSUMB, it's big. People come from everywhere and it's like so different. Everything they do there is completely different. So I feel like doing more research, like attending, I don't know, when I went, they had otter days. I'm pretty sure they still have those. And like just attending things that you can before you transfer over would be great, so you can get familiar with everything that they have to offer.
Excellent. All right. Dulce, what have you liked the most about your CSUMB experience?
The support to the next level of continue with higher education, something that I never thought of myself. Hoping and wishing that I actually move forward with undergraduate. I mean, I'm sorry, with planning to go into graduate for Masters on Social Work. Even going into university was something that I never thought of. So having the support at the CSUMB within faculty, I mean, all of my professors are being pivotal, you know, for me to continue with education. I mean, I have setbacks, and that's because of the way I learn, you know, I have a learning difference. So when I talk to them, they're very responsive to my needs and very supportive. So because of that, you know, I'm like super excited to move forward into the Master of Social Work program in the future.
Great. Good. You know, I'm actually going to kind of follow up the next question with you, Dulce, before I turn it over to Brianna. The question is, what do you hope to do after you graduate? Because you're kind of already, is that what you're planning to do, is go to graduate school?
Well, the program is going to be actually entwined with working. I have to work. I think I've been, you know, off of the workforce for the last 7 years because I become a full student at Cabrillo. And then I think it's time for me to start working like as a full-time employee, and hopefully in my internship. And then start with the program at the same time. So I'm gonna be doing both things.
Wonderful. All right, Brianna, over to you. What have you liked the most about your CSUMB experience? And then also you can tell us about your plans after you graduate.
Okay, I think the thing I like the most is the way that the program is built. Like I was saying, I really appreciate that we get a little bit of everything. You have to do a little bit of social work, you have to do a little bit of public administration and public health. And I feel like all of that has helped me, even though I'm working as an accountant, like it all helps. Like my public administration class helped me because it's geared toward like nonprofit work. So it's everything that you take there will give you skills to get some type of job. And like Dulce was saying, like the teachers are super supportive. And I feel like they like thrive on us successing. Like they're like, look at what my students doing. And then they're like, look what my students doing. Like it's awesome. And then you have a group of students that you start with, and you get to like know them. Like every semester you'll see them in all your classes, and you get to build like a little family. And then, you know, I'm excited to see like we're all graduating, and I'm excited to be like, okay, where are you going? And like, what are you guys gonna do next? Like you definitely build friendships for life, that's for sure. Yeah.
Wonderful. And then what are you thinking about for after you graduate?
Well, I need to work because I do want to get my master's in public administration at Middlebury Institute. It's a private school in Monterey, and it's going to cost me a lot of money. So I am going to work for a while, and I feel like I do need a little bit of break. I've gone to school for a long time, and you know, working, you'll still get like skills and stuff like that. So I feel like I'm going to work for a while, save up money, and then get my master's in public administration.
Excellent. And you already have your job lined up.
I do.
Excellent. Wonderful. So those are the questions that I kind of had pre-prepared, but I want to just open it up and see if our students or any of our, you know, people here tonight have questions for our panelists. And you can either unmute or write them in the chat. It's a good time to ask questions. Gail, I see you. Are you coming in for a question?
No? I'm coming in. And I think this was kind of answered. First, I want to say like how, I'm jazzed, you know, like it's so fun to hear your stories and to I can almost picture, the first time on campus and figuring out where things are. Like, I just feel really inspired. And I think that Anne kind of asked this, but I'm going to ask it from a teacher perspective. So yes, we baby you. Yes, we hold people's hands. But from as a Cabrillo teacher, thinking about like our next wonderful bunch, not, I don't want, me already. I mean, some people do, but I'm not going to be that like, oh, too bad, go off and figure that out. But, maybe a little bit more guidance about, how to present, maybe there's a growth, like, okay, first semester, second semester. Any advice about, and can be practical or can just be, general advice about how teachers can better support students in that transition process? So either one, both.
I feel like a good thing would be like, maybe you're attending these, so like now you heard Vanessa tell you like what to expect from the program, and I feel like that's a good way to like let your students know like this is what CSUMB offers. Like if you don't have an idea, it's fine, you can go into it not knowing what you want to do, and you're not wasting your time. You're going to be gaining valuable skills that will help you, so just being informed and then having them, because they're probably nervous or they don't know what to expect. And then you could kind of be like, well, I attended this and now I know what you can kind of expect. Does it sound like something you would want to do, or it's interesting for you?
Yeah. Thank you.
You're welcome.
Dulce,
Yeah, for me, it would be more
got
like
anything?
yeah, for me, I would suggest, things like, the transferring departments on each part's actually really good. And the one at CSUM is actually like on top all the time, trying to bring the new community in with the programs, the workshops, all of that stuff. So I think a little bit more, invite the students more, like if you have the capacity to say that, hey, or stay a little bit of communication with them and see what is it that they have to offer prior to going into the next level. So I think just to kind of like get their feet wet, just to kind of like see how it is and add more questions, maybe pushing a little bit more for that. That would be great.
Okay. Thank you.
Well, I'm actually curious if Adrienne has a different approach or different amount of hand-holding when she teaches at Cabrillo versus CSUMB, if she just you just adapt to the philosophy or I've taught freshmen and I've taught juniors, and I know that I do different things, but I was just kind of curious with Adrienne, like if you have what your philosophy is.
Well, thank you for asking. At Cabrillo, they're freshmen, right? Most of them. So you kind of, you try to cater and to people who are coming into a college experience. But then when they get to CHHS, the interesting thing is we are preparing them to be professionals. And so, the expectations of like showing up on time and being in class and communicating when you can't be there, and like how you would in for a job, we kind of begin to influence them in that way with their behaviors in our classrooms, because it's a professional preparation program, truly, right? So that's where it shifts for me. Between the freshman, sophomore, junior, senior levels is just kind of like more professional preparedness and different levels of communication. And certainly, no matter what, I love to cater and I love to brag. So I do that with them all. Like I'm like so impressed with each of them and who they are, starting when they're freshmen and then all the way up.
Adrienne, you're in a really neat situation to see students both when they start at Cabrillo and then get to see them at CSUMB as well. Yeah,
it's a real privilege.
Yeah. All right, so I don't see any other questions in our chat box. Are there any? I'm gonna do a little scan around the room, see if there's any other.
I did.
Okay, awesome.
Okay, sorry. So I know that CSUMB offers like there's different types of orientations and registration events and things like that. But I don't know. Do you feel like that kind of, those orientation events were helpful. And I know that like Dulce, it was COVID when you transferred, so that might have been a different experience. But Brianna, maybe for you?
I definitely did. I loved orientation day. It was so fun. It got me so excited. And I feel like it is a good practice. And I'm like, I've attended a lot of different. So I went to my orientation, and then with you, I am actually working. I attended the one because I want to be a mentor for next semester. So I attended that. So I feel like they're super like informative, and I feel like they work. So I feel like you should continue to do that. Yes, even if it's on Zoom or like something, it gets everybody excited. Yes.
Do you have something?
And if
to add,
anybody's,
Dulce?
oh, go ahead.
Yeah, I was just, maybe Dulce had something to add. She always has, good feedback.
Yeah, you actually were right. I didn't actually mention that, but on COVID, everything was online and didn't feel the same. It definitely, I missed a big chunk of information that I would have obtained because I was looking forward to it. I actually originally reserved the spot, for me and my partner to go and visit the campus, and even my daughter, because I was so excited to go over there and everything, and didn't have the opportunity. So maybe that's the reason why it was different for me, a little bit more like missing that connection early on. That would be, amazing.
I was going to say we are doing an event in, I don't remember if it's late November or early December, but for anyone that's transferring in January, or if anybody just wants to get a heads up, we're doing some events for students that are about to transition, that are targeted specifically for Cabrillo students, to talk about transition and kind of like feel your cohort as you transfer. So those, if anybody's transferring soon, that would be great to go to those.
Yeah, I'm glad you mentioned that, Sharon. A lot of through our Title V grant, and we're doing a lot of collaboration between Cabrillo and CSUMB, and our transfer centers are more connected. We also have the 2+2 program, and I think we're getting a lot more workshops and connections going on, so that students that are transferring, whether they're part of the 2+2 program specifically or not, they're going to be invited to, oh, there's a next steps workshop. Oh, there's like my own special orientation workshop. And also the transfer center at CSUMB is relatively new as well. I think it started like right before COVID. And so we've been kind of growing up together in a way, and they're doing so much to create more connection and have like affinity groups for students. So I feel like that rocky transition period, we're doing a lot between Cabrillo and CSUMB to try to make it like just have the connections come earlier, like you both recommended, that Cabrillo students should really be like connecting to CSUMB before they start as students. So we're trying to really line that up, but for the whole term prior to transfer.
Yeah, like I was looking, so that like on December 17th, which is a Friday late in the afternoon, because we figured hopefully it's after your finals. It's like if you want to learn about how do you upload your, like what's the deal with the vaccination requirements at CSUMB? How do you access your financial aid? What are the deadlines? And so we're doing that kind of stuff specific for Cabrillo students. And that's in addition to the regular orientation. So
Cabrillo getting a lot of love.
Yeah.
We like that. So I'm going to go ahead and introduce our career speaker now. And I'm going to read a little short bio. So it's my pleasure to introduce our final speaker for tonight, Lilia Chagoya, Regional Operations Director for Santa Cruz and Monterey Counties, Central California Alliance for Health. It's a long job title. She's currently employed by the Central California Alliance for Health since 2004, where she currently serves as Regional Operations Director for both Santa Cruz and Monterey counties. In this role, Lilia is responsible for overseeing the Alliance's Salinas office, management of Alliance programs and operating procedures in Santa Cruz and Monterey counties, leads the Your Health Matters outreach program for the organization, and acts as the plan's regional community liaison in both counties. It sounds like a pretty big job. Lilia holds a bachelor's degree Bachelor of Science degree in Community Health Education from San Francisco State University and studied at Universidad Autónoma de Guadalajara, Mexico. She also served as a board member for the Santa Cruz Women's Health Center and Women Care, both in Santa Cruz, California. And she currently serves as a commissioner for the Monterey County Commission on Disabilities and as an advisor for the Cabrillo College CHW program. So welcome, Lilia. We're so happy you can be with us tonight.
Thank you. Thank you very much. Good evening, everybody. It's good to see all the new faces here. So I'm very honored to be invited to participate and share about my career and just my story in here in this community that I love, that I grew up in. I always like to start a little bit with my background because I think people, that connection is very important. That connection to the human side of you is very important. And for me, it's just to share a little bit about me that makes who I am as a professional as well. I'm the youngest of 7 kids, and I'm the first sibling to earn a degree in my family. I immigrated to this country with my parents as a very young child and was raised in Santa Cruz County by 2 parents who worked very hard locally in the local canneries and factories in Santa Cruz County. So I'm very proud to represent them here. I've also, my parents are both retired in their mid-80s. So they're a big part of my life and my family's life. So with that said, as a high school student, I wasn't sure what I wanted to do. And so I went to Cabrillo, which was probably the best decision I ever made. And I always tell people, and I've told my friends and my family and people that are at Cabrillo College, I probably received my best portion of my education at Cabrillo College when I started. I was given such a broad perspective. I was challenged. I was given opportunities, and I was also given support as a student. And this was many years ago. Just to kind of, so you can calculate, I graduated with my bachelor's degree about 27 years ago. So it's been a while. And so, Cabrillo College, even then, back in the early 90s, late 80s, was just an amazing college. So that's where I started my career, I believe. I didn't receive a degree from Cabrillo. I transferred directly to San Francisco State University. And while I was there, for the most part, I lived there. But at my last year, I wanted to start getting integrated in the communities where I wanted to work, and that was in this area. So I started volunteering at Planned Parenthood Marmonte. Back then it was Planned Parenthood Santa Cruz downtown. And I volunteered to whatever they wanted me to do. I would stand there and open the door for people if that was the case, because I was really interested in healthcare. And I didn't know what community health was yet. I didn't understand really the true concept at Cabrillo College. But when I went to San Francisco State, I understood that. I knew that community health was so important in developing the person and who they are as a whole person. And your health is one of the most important aspects to push you forward. So I started there at Planned Parenthood as a volunteer, and within a few months, because they made aware that I spoke Spanish, I was offered a part-time position while I was still a student as just a person that would just help room some of the patients at Planned Parenthood at the clinic. And I did some very minor support work there as just filing and just doing various things. But I learned a lot about the operations of the clinic, customer service, health, and just being able to care for somebody and be able to educate and inform them around their health. So that was very important to me. Soon after that, I was able to, during my time at San Francisco State, I started learning, I started doing more my internship. And my internship back at San Francisco State, it's been a while. It was around assessing and following some moms, HIV positive moms at the Mission Healthcare Center in the Mission. And so a group of us, several students of us, did our internship there, our senior internship. And that's where I fell in love with just public health. And so after that internship, I was able to come back to Santa Cruz County, and I was offered actually a full-time job as a health educator for Planned Parenthood. And I did that for a couple of years, where I was able to work with the school systems here, the various schools, and as well as some of the local hospitals and partnerships with just some of the work that between some of the clinics and the local hospitals do currently with patients. And with that, I was able to continue learning. So, I feel like even today in my position, I've always am learning. I'm always trying to understand what is the need of the people that we're serving, right? The dynamics. And one of the things that I learned early on in my career is that it's very important to always understand the importance of relationship building. I felt that at Planned Parenthood, when I was a health educator there, I built relationships where at various organizations where I was able to be, I was actually reached out to by a local clinic leader and invited me to apply to a position at Dominican Hospital as a CPSP coordinator / support person, kind of a social work job, because they knew what my skill set and my experience was working with the community within Santa Cruz County, and I was bilingual. So I think I was very fortunate to be invited to that position, and that's where I really feel that I was able to serve the community. I started in at Dominican Hospital at the outpatient clinic, and when they had some clinics on Frederick Street, I don't think they have any outpatient clinics there anymore. It was the prenatal clinic that was serving the Medi-Cal population, as well as in about 3-4 years later, we opened up a pediatric clinic that was serving the children that were born to the women who were pregnant there. So I spent about 3 to 4 years there working in the clinic setting, but really not as a clinical person, more as a support person that was engaging and providing information and resources to some of the families and the parents there, as well as being able to help them understand the resources that were out in the community. With that, I got a little bit of an itch, and I decided that I needed to leave Santa Cruz because I was still young. I wanted to see what I wanted to do with my life. And so then I went back to San Francisco, where I love being there. And I started working for Boys and Girls Clubs of San Francisco, completely different setting, but something that I really loved and enjoyed. And at Boys and Girls Clubs of San Francisco, I was given a position as a health services manager. And a lot of people don't think of like, okay, what is Boys and Girls Club of San Francisco? They babysit kids, they teach them how to play sports. Well, really, that's not really what it is. They really do the whole, it's a wraparound services on supporting families and their children. So healthcare, emotional support, access to services. I mean, that's just a huge component of what Boys and Girls Clubs does in supporting youth in the community. So I was given the opportunity to be the health programs manager there, where I actually served, there was 9 clubhouses, 11,000 kids and their families. And I was able to build these relationships with UCSF Dental School, where they came in and provided exams for our kids. They were able to provide a bunch of different services for dental services for kids that lived in underserved populations, right? They were living in the Mission and the Excelsior and the Tenderloin, where they didn't have a lot of access to care. I was also able to provide free glasses to some of the kids that didn't have access to that. We partnered with some of the local optometrists, and it was just really fun work, but really, really intense work, where we also taught families and children around healthy eating, nutrition. We gave them nutrition classes. And we also, part of health and safety is, preventing violence.
Yeah.
And one of the jobs that I had is overseeing some of the programs in keeping kids out of gangs. So we would do midnight basketball parties where we would provide pizza for these kids and have them come into the clubs and play basketball until 1 or 2 in the morning so they wouldn't be out in the streets and involved in the gangs. So that was all part of public health. And it was just amazing work, very rewarding, but also very hard work where I just felt like I just learned every day, learned about the population that we were serving and learned about the organizations that I was partnering. And I think, the biggest thing here in my career has always been building those relationships with people, building the relationships with organizations to partner and learning every day. From there, I came back to this area and that's when I applied to this position as a health educator at the organization that I'm currently in, Central California Alliance for Health. And one of the questions that I've always had was, why did you go from a health management position into an education position at this organization? And sometimes, we have to understand and choose what we do in order for us to be able to grow. So I came into this position knowing that I needed to learn the organization, the work that we do, and understand it. And if I had the, knowing that I have the tools to grow and be able to do more for the organization, I felt like this was a good start for me to be able to understand being hands-on with people, being hands-on with the community. As a health educator, gave me the tools to be able to grow within the organization. And one of the things that, I get a lot of questions is that, why didn't you pursue your master's? I've always wanted to do that. But, one of the things that my career has given me so much of the experience, and I haven't been there, but it's never too late, right? I would recommend that if anybody ever decides to go into your higher education, do it. Go ahead and just do it, but understand what you want to do as in your career. Be able to have that that will to do it, and be able to either do it at the same time while you're working or however you want to do it, but be able to understand what it is that you want to do with that. And so that was very important for me. But within my career, I feel that some of the things that I've been able to do is in health education, I was able to transition from that role to manage the department in health education. So as a health programs manager, soon after I was hired at the organization, I was able to serve our Medi-Cal population and the 3 counties that we serve right now, Monterey, Merced, and Santa Cruz. And within 3 years after I was in my management position, I was offered the position for regional operations director. And as this role as regional operations director, this role is really more of a public health and community health role. It has the title of operations, but really I'm the community liaison where I build relationships. I collaborate with many organizations across our 2 counties. I work with educational institutes to make sure that we promote our services and really empower our members to access care. I also lead the outreach program. I'm one of the committee members in our diversity, equity, and inclusion committees here at the organization. And I also am, very, very involved in my community. And I think that's one of the things that it really gives me the pleasure is just to be, not just, my job is my job, but it's also something that I really enjoy every day. I enjoy working for the organization. I enjoy serving the population that we serve. And for me, I think my biggest motivator is to continue to advocate for health equity across our communities. And that's one of my biggest drives that I have as a person in my career. And with that, I'll just say that, it's just a pleasure to be able to share my experiences. I do have to say that I didn't really know what to share, but I felt like I wanted to be able to share just my experiences in general, because not everybody has a different approach to your career. And for me, it's been, just I've been fortunate enough to be in one organization for a long time, but I think it was due to the fact that I was able to experience many other organizations and then settle into a place where I really enjoy. So with that said, I'll just end it with that. And I know we're almost out of time, and I'm happy to take any questions.
Yeah, any questions? Sharon, I agree, very inspiring. I love all your themes of growth and community and connection. And it's and you just model really well what does it actually look like to be in public health and serving the community, and then grow, and then this trajectory of growth and passion. Does anyone have any questions before Lilia, before we say goodnight for the evening?
Again, not a question, but just thank you so much. I love to hear people's stories, and I think it's really important. Like I know that most of our stories are, in terms of our careers, are really unique. And I don't know, like when people are starting on their path, that they realize there's a lot of ways to get where you're going to get. And I think that your example of this is how this worked, and it's like it gives us permission to know there's just no one right way where you get on the road and you keep going. There's a lot of ways, and also to think about, as you did, be planful in terms of thinking about, well, if I do this, then I can do this, and sort of in a purposeful way, but allowing a lot of room for your journey. So thank you so much. Inspiring. Yeah.
Wonderful. Well, thank you, everyone. It is 7 o'clock, and I just really appreciated another wonderful hour. We pack a lot in an hour in these events, and thanks so much for your time. I learned a lot, and I feel all filled up with inspiration. Have a good night, everyone.
Thank you,
Thank you.
everyone.
Bye, everyone.
Good night.
Bye.
Thank you. Good to
Thank
see you.
you.
all.
Good night.